Hello, my name is Allison Thurman, and I'm a senior level nursing student at Ostomy Care University. And today I'll be talking about ostomy care, specifically the care for the stoma and how to put on a new wafer and bag system. First, you would need to gather all of your supplies. You're going to need a couple pairs of clean gloves, your new ostomy wafer and bag, or however it comes. If the patient wears a barrier ring or a barrier paste, you want to grab that. You're going to need some washcloths and some towels. And also, you're going to need a pair of scissors and maybe a pen. Okay, and then you want to go ahead and go in your patient's room and wash your hands. And you've checked your order, so you know you're supposed to be doing this. And you talk to your patient, let them know what you're about to do, and if they can help and want to help, allow them to help. If not, you just go ahead and get it done for them. The first thing that you're going to want to do is let them lay back or as flat as they can maybe, and expose their stomach, but cover up their private parts and make sure that they're comfortable. You want to visualize your ostomy bag that's already in place, and depending on where it is on the colon or from the ileum, that's going to determine what kind of stool is in the bag, whether it's loose and watery or more formed. Just be careful when you're going to either empty it before you take it off, or just be really careful when you take the whole system off, not to spill any on the patient. Okay, and when you're taking it off, be very careful peeling back that adhesive. You don't want to cause any extra trauma or breakdown to the skin. So if you have to moisten it or whatever you have to do just to get it off safely. And once it's off, you want to take a look at the stoma. You're looking to see if it's, that good beefy red color, and it should be soft. You don't want a blue or ashy stoma, because that's cyanosis in it. That means it's not getting good oxygen blood flow. And if it's black, that means it's necrotic, and that's a big problem. And you also want to make sure that it doesn't look inflamed, because that could mean that it's infected. So once the bag is off and you're cleaning the stoma with mild soap and water and the skin around it, you want to pat it dry. Make sure it's nice and dry and clean. Depending on where the stoma is on the body, it's going to kind of determine how long you have before more stool starts to come out. So if it's on this ascending end, you want to move pretty quickly, because that liquid's going to start coming out pretty soon. But it's clean and dry now, so you want to grab your wafer. And some facilities have a little sheet thing that helps you measure the stomas. It says different circle sizes, and you just put it on there to see which size best fits your patient's stoma, and then you can mark it out on your wafer, and that's what you might need your pen for. Or you can just hold your wafer up next to it and just eyeball it and see where to cut. So when you cut, you want to make sure that you're cutting as smooth a line as possible. I know some facilities have those curved ostomy scissors, so if you have those available, that'll be best. But once your circle's cut out, you want to put it back on, put it over the stoma, and make sure you got a good fit, okay? You don't want it to be too small, because that can lead to constriction, which can cause either that cyanosis or necrosis of the stoma, and we don't want that. And you don't want it to be too big, because that can cause some leakage of stool onto the surrounding skin, and we certainly don't want that, because that'll cause breakdown. But once you get your wafer circle as close to the size of the stoma as possible, you want to go ahead and peel the back. Well, let's go back. You got the circle right, and then if the patient wears one of those barrier rings or some barrier paste, you want to go ahead and put that on there before you put on the wafer. But once it's on, peel the sticky paper away from the wafer and stick it on there around the stoma, and make sure you got a really good seal all the way around. If it is a one piece, you'll put it on there and that'll be it. If it's a two piece, you stick the wafer on, and then you take the bag and you click it into place. And then you want to make sure that the bag is closed at the bottom. However, it may close either with the clip or with the little rolled up Velcro pieces. And that'll be it. You discard everything and you wash your hands again and make sure your patient is comfortable. Thank you for watching.